If you ejaculate and no semen comes out, do this immediately. Things to do. If you're over 60 and ejaculate but no semen comes out, this could signal serious health issues you can't ignore. This condition affects thousands of men and may indicate diabetes complications, prostate problems, or medication side effects that need immediate attention. In the next few minutes, you'll learn 5 critical actions to take immediately. I'll reveal the specific medical tests you need within 48 hours, the medications that commonly cause this problem, lifestyle changes that can reverse the condition when surgery might be necessary, and natural methods that have helped thousands of men. You'll understand exactly what's happening in your body and the precise steps to address it effectively. Let's talk openly about something many men experience but few discuss. When ejaculation occurs without semen, it's called dry orgasm, and you're not alone. This happens to approximately 30% of men over 60. Your body is still functioning, but the semen is either not being produced or travelling backward into your bladder instead of out through the urethra. This isn't a failure on your part. It's a medical condition with identifiable causes and real solutions. Thing number 1. Schedule a comprehensive medical evaluation within 48 hours. The absolute first thing you must do is contact your doctor and schedule a complete evaluation. I'm not talking about a routine checkup next month. This needs to happen within the next 2 days, and here's exactly why timing matters so much. Your physician needs to conduct a post-ejaculation urinalysis. This simple test involves providing a urine sample immediately after ejaculation. If sperm cells appear in your urine, you have retrograde ejaculation, meaning your semen is flowing backward into your bladder. If no sperm appears anywhere, you're dealing with aspermia, which requires different treatment entirely. This distinction is crucial because the solutions are completely different. During this evaluation, your doctor should check your prostate health thoroughly. An enlarged prostate or prostate surgery in your past could be compressing your urethra or affecting the muscles that control semen release. A digital rectal exam and possibly a PSA blood test will reveal whether your prostate is contributing to this problem. Your blood sugar levels need immediate testing as well. Uncontrolled diabetes damages the nerves that control ejaculation, particularly the nerves around your bladder neck. Many men discover they have diabetes or pre-diabetes only after this symptom appears. If you're already diabetic, your current management plan may need adjustment. Bring a complete list of every medication and supplement you're currently taking. Write down the names, dosages, and how long you've been on each one. Certain blood pressure medications, particularly alpha blockers, antidepressants, and prostate medications, can directly cause dry ejaculation. Your doctor might need to switch you to alternative medications that don't have this side effect. Don't minimize or hide any details during this appointment. Mention when you first noticed the change, whether it happened gradually or suddenly, if you've had any pain or discomfort, and whether you've experienced any urinary changes. These details help your doctor pinpoint the exact cause faster. Request a testosterone level check during this visit. Low testosterone doesn't directly cause absent semen, but it often accompanies the same underlying conditions. Plus, if treatment is needed, knowing your baseline hormone levels helps track your progress. Thing number 2. Review and adjust your current medications. The second critical action is conducting a thorough medication review with your pharmacist or doctor, because the pills you're taking right now could be the direct cause of your dry ejaculation. This is actually one of the most common and most fixable reasons for this condition. Alpha blockers prescribed for enlarged prostate or high blood pressure are frequent culprits. Medications like tamsulosin, alfuzosin, doxazosin and terazosin relax the muscle at your bladder neck, which is exactly what causes semen to flow backward instead of forward. If you started experiencing dry ejaculation within weeks or months of beginning one of these medications, you've likely found your answer. Antidepressants, particularly SSRIs like sertraline, fluoxetine and paroxetine, can significantly impact ejaculation. These medications affect the neurotransmitters that control sexual function. Some men on these drugs experience delayed ejaculation, reduced semen volume, or complete absence of semen. The challenge here is that you can't just stop an antidepressant suddenly, but your psychiatrist might switch you to bupropion or mirtazapine, which have fewer sexual side effects. If you take medications for an overactive bladder like oxybutynin or tolterodine, these anticholinergic drugs can interfere with the muscle contractions needed for normal ejaculation. Your urologist can explore alternative treatments for bladder control that won't affect your sexual function. Certain antipsychotic medications and some drugs used for nerve pain also disrupt the complex nerve signals required for proper ejaculation. Even some over-the-counter antihistamines and decongestants, when taken regularly, can contribute to this problem. Here's what you need to do specifically. Create a timeline showing when you started each medication and when the dry ejaculation began. This visual connection often reveals the culprit immediately. Then schedule a medication reconciliation appointment where you sit down with your healthcare provider specifically to discuss alternatives. Ask about medication holidays if appropriate. For some drugs that aren't life-critical, your doctor might approve temporarily stopping them to see if your symptoms improve. Never do this on your own, as some medications require gradual tapering. Explore whether lower doses might work for your condition while reducing side effects. Sometimes the therapeutic benefit remains even at reduced dosages, but the sexual side effects disappear. Consider asking about timing adjustments. Taking certain medications at different times of day or planning intimate activity during the period when drug levels in your system are lowest can sometimes make a difference. Document everything. Keep notes on any changes you make and whether your symptoms improve, worsen, or stay the same. This information becomes invaluable for finding the right solution. Thing number 3. Implement targeted pelvic floor exercises and bladder training. The third action involves strengthening the muscles that directly control ejaculation through specific exercises that can restore normal function. Your pelvic floor muscles work like a hammock, supporting your bladder and controlling the release of semen, and when these weaken with age, problems develop. Kegel exercises aren't just for women. These exercises target your pubococcygeus muscles, which contract during ejaculation to propel semen forward. To locate these muscles, stop your urine stream mid-flow next time you're urinating. Those muscles you just squeezed are your pelvic floor. Now that you've identified them, you can exercise them anywhere without anyone knowing. Start with basic contractions. Squeeze those pelvic floor muscles and hold for 5 seconds, then relax for 5 seconds. Repeat this 10 times, 3 sessions daily. As you get stronger over the next 2 weeks, increase the hold time to 10 seconds. The key is consistency. These muscles respond to regular training just like any other muscle group in your body. progress to quick pulse exercises. Rapidly contract and release your pelvic floor muscles 10 times in a row without holding. This builds the fast-twitch muscle fibers responsible for the powerful contractions during ejaculation. Do 3 sets of these pulses twice daily. Add resistance training by doing Kegels while sitting on a slightly deflated exercise ball or while standing with a slight squat. This added challenge accelerates muscle development and improves the neural connections between your brain and these muscles. Bladder training addresses retrograde ejaculation specifically. Practice holding your urine for progressively longer intervals to strengthen your bladder neck sphincter. Start by adding just 5 minutes to however long you currently wait between bathroom visits. Each week, add another 5 minutes until you can comfortably wait 3 to 4 hours between urinations. This trains the sphincter muscle to stay closed with more force, which helps direct semen outward instead of backward. Coordinate breathing with your exercises. Inhale deeply through your nose while relaxing your pelvic floor. Then exhale slowly through your mouth while contracting these muscles. This breathing pattern enhances muscle control and makes the exercises more effective. Practice during intimate moments too. When you feel ejaculation approaching, consciously engage your pelvic floor muscles with strong, deliberate contractions. This real-world application reinforces the neural pathways and often produces immediate improvements in semen propulsion. Avoid common mistakes that reduce effectiveness. Don't hold your breath, tighten your abdomen, or squeeze your buttocks during Kegels. The contraction should be isolated to your pelvic floor only. Don't overdo it initially, as muscle fatigue can temporarily worsen symptoms. Track your progress weekly. Note any changes in sensation during ejaculation, any visible increase in semen volume, and improvements in urinary control. Most men see noticeable results within 6 to 8 weeks of consistent practice. Verse 4. Optimize your hydration and nutritional intake. The fourth critical action focuses on what you put into your body, because semen production depends heavily on proper hydration and specific nutrients that many older men lack. Your seminal fluid is composed of 95% water, so dehydration directly reduces volume and can even halt production entirely. Start drinking 8 to 10 glasses of water daily, spread throughout the day. Don't chug it all at once. Your body can only absorb about 8 ounces per hour efficiently, so consistent intake matters more than total volume. If your urine is darker than pale yellow by mid-afternoon, you're already dehydrated. Keep a water bottle with time markers to track your intake accurately. Zinc plays an irreplaceable role in semen production and testosterone synthesis. Men over 60 need 11 milligrams daily, but most get barely half that amount. Oysters contain the highest zinc concentration of any food, but if those aren't practical, eat pumpkin seeds, beef, chickpeas and cashews regularly. A handful of pumpkin seeds daily provides substantial zinc along with other beneficial minerals. Selenium supports prostate health and sperm quality. Brazil nuts are extraordinarily rich in selenium. Just 2 Brazil nuts daily gives you the optimal amount. Sunflower seeds, fish and whole grain bread also provide good selenium levels. Don't exceed the recommended amount, as too much selenium causes problems. L-arginine, an amino acid found in turkey, chicken, pork, pumpkin seeds and dairy products, increases seminal fluid volume. Your body uses L-arginine to produce nitric oxide, which improves blood flow throughout your reproductive system. Aim for foods rich in this amino acid at least once daily. Omega-3 fatty acids from fatty fish like salmon, mackerel and sardines improve overall reproductive health. These healthy fats reduce inflammation that can impair glandular function. Eat fatty fish 3 times weekly, or take a quality fish oil supplement after consulting your doctor. Reduce or eliminate alcohol consumption. Alcohol dehydrates your body significantly and suppresses testosterone production. Even moderate drinking of 2 drinks daily can reduce semen volume by 30%. If you currently drink regularly, cut back to occasional consumption only. Limit caffeine intake to no more than 2 cups of coffee daily. Excessive caffeine acts as a diuretic, forcing water out of your system faster than you can replenish it. Switch afternoon and evening beverages to herbal tea or water. Eliminate processed foods high in trans fats and refined sugars. These foods promote inflammation throughout your body, including your prostate and seminal vesicles. Replace packaged snacks with whole foods like nuts, fruits and vegetables. Add lycopene-rich foods like tomatoes, watermelon and pink grapefruit. Lycopene concentrates in reproductive tissues and supports healthy glandular function. Cooked tomatoes provide more absorbable lycopene than raw ones. Consider vitamin D supplementation after testing your levels. Many men over 60 are deficient, and vitamin D influences testosterone production directly. Spend 15 minutes in sunlight daily when possible and discuss supplementation with your physician. Track your dietary changes for 1 month alongside any improvements in your condition. This helps identify which nutritional adjustments make the biggest difference for your specific situation. Thing number 5. Explore medical treatments and therapeutic interventions. The 5th action involves understanding the medical treatments available when lifestyle changes and exercises aren't enough. Modern medicine offers several effective interventions specifically designed to address dry ejaculation, and knowing your options empowers you to make informed decisions with your healthcare team. Pseudoephedrine, the decongestant found in cold medications, can effectively treat retrograde ejaculation by tightening the bladder neck sphincter. Your doctor might prescribe 60 milligrams taken 1 hour before intimacy. This medication forces the bladder neck to close more completely, redirecting semen outward. Many men experience immediate results, though this isn't a permanent cure and works only while you're taking it. Imipramine, a tricyclic medication originally developed as an antidepressant, also tightens the bladder neck sphincter. Doctors prescribe low doses specifically for retrograde ejaculation. This option works well for men who can't tolerate pseudoephedrine or need a daily medication rather than taking something before each intimate encounter. Midodrine strengthens the muscle tone around your bladder neck through a different mechanism than the previous medications. Your physician might try this if other options haven't worked. It requires careful blood pressure monitoring since it can raise blood pressure, but for men with normal or low blood pressure, it's highly effective. If medication caused your dry ejaculation and switching isn't possible, timing strategies become important. Some doctors recommend taking your dose at times that minimize its presence in your system during intimate activity. This requires coordination with your prescriber to ensure your primary condition remains controlled while reducing sexual side effects. Nerve stimulation therapy represents a newer approach for men whose dry ejaculation stems from nerve damage. Transcutaneous electrical nerve stimulation applied to specific areas can sometimes restore proper nerve signaling. Physical therapists specializing in pelvic health can provide these treatments. Surgical options exist for severe cases that don't respond to other treatments. Bladder neck reconstruction can repair a sphincter that won't close properly. Transurethral resection might remove scar tissue blocking normal ejaculation. These procedures carry risks and recovery time, so they're reserved for cases where quality of life is significantly impacted and nothing else has worked. Hormone replacement therapy becomes relevant if testing reveals low testosterone contributing to your condition. Testosterone doesn't directly cause dry ejaculation, but optimizing your hormone levels improves overall reproductive function and often enhances the effectiveness of other treatments. Your endocrinologist can determine if you're a candidate for testosterone supplementation through gels, injections, or patches. Acupuncture shows promise for some men, particularly when nerve signaling issues contribute to the problem. Licensed acupuncturists trained in reproductive health can target specific points that influence pelvic nerve function. While research is still limited, many men report improvements after 8 to 12 weekly sessions. Work closely with a urologist who specializes in male sexual health rather than general practitioners. Specialists have more experience with these specific conditions and stay current on the latest treatment protocols. Don't hesitate to seek a second opinion if your first doctor dismisses your concerns or offers limited options. Remain patient with treatment. Most interventions require 4 to 8 weeks before showing full effects. Keep detailed records of what you try, dosages, timing and results to help your doctor fine-tune your treatment plan. Dry ejaculation doesn't mean the end of your intimate life or vitality. You now have 5 powerful actions. Get evaluated immediately, review your medications, strengthen your pelvic floor, optimize your nutrition, and explore medical treatments. Thousands of men have reversed this condition by taking these exact steps. Your body is resilient, and with the right approach, improvement is absolutely possible. Take action today, not tomorrow. Don't let embarrassment stop you from reclaiming your health. Schedule that doctor's appointment right now before you close this video. Your well-being matters, and you deserve answers and solutions. If this information helped you, hit that like button and share it with someone who might be struggling silently. Subscribe for more honest health advice tailored specifically for men over 60. Your best years are still ahead of you.